We know that when children have a cardiac arrest, they usually do not survive. And if they do survive, they have a high morbidity. If we can prevent this from happening, then we need to. Children may show signs of deterioration up to 24 hours ahead of time. If we can recognize the signs of deterioration earlier, then we can intervene earlier, and the evidence shows that we can. When the healthcare team sees a child for the first time for an initial assessment, a diagnosis and treatment plan is made. We have an expectation that the child will recover. This is the expected recovery trajectory. However, for some children, it doesn't always work out that way, and they go down, down, down. To use an analogy, you smell smoke before you see fire. In a pediatric patient, you start to see the subtle signs of deterioration, and then the little fire rapidly grows. As things get worse, the child gets further from that expected recovery trajectory, making it harder to get back to recovery. So if we can identify and intervene early on, using Pews, we can mitigate the risk of deterioration in pediatric patients. Child Health BC has implemented the Pediatric Early Warning System as BC Pews for inpatients and BC Pews for ED. BC Pews is a system comprised of a validated clinical scoring tool, situational awareness factors, a standardized provincial escalation aid, a communication framework, and a nursing assessment documentation record. However, Pews is not a substitute for clinical assessments or clinical judgment, but aids in the identification of risk of deterioration. When the team is added to these components, the result is a system which supports improved recognition and response to pediatric deterioration by identifying pediatric patients who are at risk of deterioration, mitigating the risk through clinical and procedural response, escalating to a higher level of care if mitigation is unsuccessful. Evidence has demonstrated that Pews can be integrated into the patient assessment at triage in less than 90 seconds. It also supports that there is significant improvement in documentation of baseline vital signs and observations being documented and repeated as required. Nurses report improved pediatric assessment skills and feel better supported by the team as the patient requires intervention or escalation of care. The literature has demonstrated that Pews is a good predictor of ICU admission. A Pews score is calculated on all pediatric patients presenting in the emergency department, including at triage, who do not require emergent care or resuscitation. A Pews score is to be calculated with every set of vital signs. When assigning the CTAS score, consider the CTAS guidelines, the Pews score, and situational awareness factors. Pews cannot be used independently in the ED and is not to replace the triage tool. In the inpatient setting, a Pews score is calculated with every full patient assessment, including at the start of a new shift and at a minimum every 4 hours. The BC Pews has now been implemented in emergency department and in inpatient settings across British Columbia. The Pews system parts are designed to provide a standardized framework and language to identify potential deterioration in a child, mitigate that risk, and escalate care as needed, all as early as possible. This is a unique initiative and the first of its kind in North America, where an entire province or state adapts a standardized early warning system for pediatrics. A robust quality improvement and evaluation strategy to support sustainability has been developed as part of the initiative. The results from this will help us to continue to optimize and enhance the system as we move forward.